Chapter 4. We continue here with next subheading, Disability Etiquettes. Disability etiquettes, the rules of etiquettes and good manners for dealing with people with disabilities are generally the same as the rules for good etiquettes in society. These guidelines addresses specific issues which frequently arise for people with disabilities in terms of basic etiquettes for working with people with different kind of disabilities. Since everyone is different, these guidelines only hold true for most individuals most of the time. Etiquette for communicating with people with disabilities are as follows. When talking with a person with a disability, speak directly to that person rather than through a companion or sign language interpreter. When introduced to a person with a disability, it is appropriate to offer to shake hands. People with limited hand use or who wear an artificial limb can usually shake hands. Shaking hands with the left hand is an acceptable greeting. When meeting a person who is visually impaired, always identify yourself and others who may be with you. When conversing in a group, remember to identify the person to whom you are speaking. If you offer assistance, wait until the offer is accepted. Then listen or ask for instructions. Treat adult as adult. Address people who have disabilities by their first names only when extending the same familiarity to all others. Never patronize people who use wheelchairs by patting them on the head and shoulder. Don't pat them. Leaning on or hanging on to a person's wheelchair is similar to leaning on or hanging on to a person and is generally considered annoying. The chair is part of the personal body space of the person who uses it. Listen alternatively when you are talking with a person who has difficulty in speaking. Be patient and wait for the person to finish rather than correcting or speaking for the person. If necessary, ask short questions that require short answers. A nod or shake of the head. Never pretend to understand if you are having difficulty doing so. Instead, repeat what you have understood and allow the person to respond. The response will clue you in and guide your understanding. When speaking with a person who uses a wheelchair or a person who uses crutches, place yourself at eye level in front of the person to facilitate the conversation. To get the attention of a person who is deaf, tap the person on the shoulder or wave your hand. Look directly at the person and speak clearly, slowly, and expressively to determine if the person can read your lips. Not all people who are deaf can read lips. For those who does lip reading, be sensitive to their needs by placing yourself so that you face the light source and keep hands, cigarettes, and food away from your mouth when speaking. Relax. Don't be embarrassed if you happen to use accepted common expressions such as see you later or did you hear about that? That seems to relate to a person's disability. Don't be afraid to ask questions when you are unsure of what to do. Next subheading is Advantages of Physical Activities for Children with Special Need. All individuals benefit from regular physical activity and children with special need especially. We could all gain from this physical, mental, social and good quality of life benefits of being active. Physical improvement improves coordination, improvement in flexibility, improvement in strength, improvement in endurance, improvement in cardiovascular efficiency, decreases the risk of obesity, improvement in motor ability, mobilized all joints of the body, improves overall fitness. Number 2, mental improvement, improvement in mood, improvement in wellness, improvement in the working of nervous system, brain release endorphins that helps to feel good and ease from depression or anxiety. Number 3, social efficiency, feeling of greater self-efficiency, improve the sense of self-esteem, new experiences, new friends, feel of independence, countering of stigmatization. Number 4, quality of life and good health, low risk of lifestyle disease, improve the working efficiency. Next subtopic is strategies to make physical activities accessible for children with special needs. The children's special educator will consult with the physical education teacher and classroom support staff to decide if the physical education program requires mild, moderate, or limited participation. Remember that you will be adapting, modifying, and changing the activity and or equipment to meet the need of the special needs students. The goal should be for the child to benefit from the physical education instruction by experiencing success and learning physical activities that will build the foundation of lifelong physical activity. The strategies are as follows. Number 1, pre-activity medical checkup. To know about the disability, medical aid must be available for that disability at the time of exercise. Previous experience of participation in the physical activity should be considered at the time of selection of sport activities. Interest, selected physical activities can be accessible if it is according to the interest of the person having disability. Capability, the selected physical activities must be according to the capability of the person with disability. Modified equipment, as per the capability of the person with disability, equipment must be modified so they can be used easily. Suitable environment, at the time of play, environment must be pleasant. All kinds of facilities must be available, such as proper lighting, proper ground, proper marking, etc. Variety of instruction. Instruction used during the exercise must be according to the nature of disability. For example, for the person with hearing impairment, visual instruction should be used. Modified rules. Rules of the sports for the exercise must be modified according to the capability of the person with disability. Modified rules. Rules of the sports for the exercises must be modified according to the capability of the person with disability. Simple to complex. When prepare the activity scheduled for persons with disability, principles of simple to complex must be followed. In starting, we should take easy exercise, then we should progressively increase the degree of load or difficulties. Involvement of various body parts in activity plan for person with disability. The selection of activity should be in such a way that involvement of maximum body parts is done. Extra care should be taken to avoid any accident during the exercise.